Well, during the month of November, many men are celebrating Movember to raise awareness about men's physical and mental health. Here to talk more about the movement and how you can stay healthy is Dr. Scott Flinn. Good morning. Thanks for being with us.
Good morning. Thanks for having me.
November is here. We're about halfway through the month. We've seen maybe the onslaught of men not shaving or just growing out the mustache specifically. Of course, that is one aspect of this movement, the lighthearted aspect to grow a beard out, right? Why are people doing it?
Yeah, it started as a light-hearted movement, as you know, and the idea is to bring awareness to men's health. And the serious side of it is really what are we doing to help take care of ourselves so we can help take care of others.
You wanted to focus on three key components. And before we dial into each of those, I feel like there is this idea amongst men that, toughen up, don't worry about it, rub some dirt in it. Is that still the mentality that doctors are telling people to go with? And it really never has been from doctors' side of things.
No, it's not what we tell folks to go with, but that is something we battle with all the time.
Right.
Men are tough, I can do this, I don't need any help and all that. And it's very important when you need help to seek help because there's help out there available for you. Don't be so proud that you can't go and get the care that you need.
And that's both physical and mental health, right?
Absolutely.
As far as physical health goes, cardiovascular health, is that still one of the leading causes of men dying in the U.S.?
It's the number one cause.
Okay.
Cardiovascular death is the number one cause, and some of it is preventable. And it's really a tragedy when someone in their 50s, the prime of life, right?
Right.
Dies from a heart attack or a stroke. That was preventable by taking care of the three modifiable risk factors of diabetes, hypertension, and lipid control. And by working on those, you can actually help prevent those strokes and heart attacks. There's some really good data that shows just those three simple things can really make a difference.
Seems like we've seen an uptick in cancer cases with men, especially colon cancer, for example. Do we know why that is or how to maybe reverse that trend?
Yeah, we don't know why that is. There's lots of theories out there. But recently, the recommendation for starting colon cancer screening moved up to age 45. It used to be age 50. And that's in response to that recognition that colon cancer seems to be appearing younger, especially in Black Americans. And so also the same for cardiovascular disease. So getting that screening is absolutely essential. If someone dies for colon cancer in this day and age, it really is a tragedy because there is ways to prevent that.
And then prostate cancer, also still a huge contributor, right?
Yeah, prostate cancer is very, very common. It's one of the most common cancers, and by screening early, you may be able to prevent having a death from that because you catch it early, you can treat it early. And that usually starts about age 50.
For people at home who say, I don't know where to begin. They maybe don't have a primary care physician. They haven't seen a doctor in a couple years or a decade or more, where they might feel overwhelmed by hearing all of these possible risk factors or, risks that they have. Where do they begin?
I do recommend going in and seeing somebody to talk about personally what your risk factors are and exploring what the recommendations are for your age and particular situation. And really the best source of that is talking to one of your primary care doctors. Just go in, get that appointment, and talk to them, and they can help you sift through all the data that's out there and all the information.
This could be the reminder for people at home, maybe if they haven't had a physical recently, to just go in and, like you said, kind of specifications. For Blue Shield, where can people go for more info?
Yeah, so in Blue Shield, we have a website called Wellvolution that goes through a lot of the wellness programs that you can get and also a lot of the screenings and helps you on your way to wellness.
Fantastic. Dr. Scott Flinn, Regional Medical Director for Blue Shield of California. We appreciate you being with us. Wishing the best to all the men out there seeking mental and physical health. We'll be back after this.